By now, you've probably heard about Transitional Care Management, TCM. It was introduced by CMS with the important goal of reducing rehospitalization. To make that happen, they incentivize payments to the physicians. TCM comes with its own set of requirements. The physician needs to communicate with the patient or caregiver within 2 business days of discharge from the inpatient facility. Next comes the face-to-face encounter. Patients with severe complexity have to be seen by a physician within 7 days of discharge, and those with moderate complexity within 14 days. The third requirement is that of completing the TCM 30-day worksheet. Considering their busy schedule, this can be a challenge for the physician's office. And last but not least, the TCM visit can only be billed if the patient is not readmitted to the hospital within 30 days of their discharge. The physician's responsibilities have increased tremendously with the changing healthcare landscape. The demands of being a patient-centered medical home, PCMH, are mounting. The burden on the office staff is excessive. Tracking every movement of the patient population is cumbersome. How can all this be accomplished? T.O.N.E can help. Since T.O.N.'s registered nurses visit the patient within the first 24 hours of discharge, they can effectively coordinate with the physician. This satisfies the physician-patient communication requirement of TCM. T.O.N.'s clinical staff has been trained regarding TCM. They educate the patient about the importance of visiting their physician within the stipulated time frame, thus meeting the face-to-face requirement of TCM. T.O.N.'s nurses are well versed with the documentation requirement of the TCM 30-day worksheet. They can effectively assist the physician to complete the worksheet. T.O.N.'s clinical staff communicates and coordinates patient information with the physician and the involved caregiver in a timely and effective manner. Early detection and effective intervention in chronic disease management holds the key for keeping patients out of the hospital. Evidence-based research has validated that TCM can effectively reduce rehospitalization, thus improving outcomes for our patient population, a vital payoff for the PCMH and ACO, ultimately resulting in a satisfied patient who remains in the comfort of his own home.